All right, James, welcome to PACU.
Hey, thank you.
My name is Sarah. I'm going to be your RN today.
All right.
I see your medical assistant, also named Sarah, already came and introduced herself. It looks like that was last night, so she's gone home, but I'll go ahead and write my name up here for you. So my name is also Sarah, and PACU's pretty small. I don't think you're going to need to page me, but I'll go ahead and give you my extension. It's going to be 69858. In case you do need to call me, you can use your call light, or you can page me on the room phone. So I'm just going to get a set of gloves on and tell me a little bit about what's going on. You're having surgery this morning.
Yeah, I have a surgery on my hand here.
Yeah.
Yeah.
Are you in any pain currently?
Yes, I am.
Okay. What's your pain level right now?
Probably about a 5.
A 5. Okay. So kind of 5 standing pain.
Yes.
So can you tell me a little bit about what happened? I heard something about an attic window.
Yeah, I was upstairs in my attic trying to open up the window to get some fresh air in there. And apparently the window was painted shut. So when I pulled it up, the window just shattered. So there's for sure glass in there.
You probably have some glass shards in there.
Yes.
Sounds like it would be pretty uncomfortable.
No fun at all.
Okay. Well, basically what I'm going to be doing as your PACU nurse is going over a couple things with you. Okay. I do need to start an IV. Your surgeon has elected to do just general awake anesthesia. So you will be awake for the procedure, but you will be kind of semi-sedated. Okay. Is that something you're comfortable with?
That's fine.
Okay. Aside from that, I do need to just do like a brief inspection, make sure you're looking okay, make sure you're breathing okay. We already have you on the oxygen and you've been on oxygen all night, correct? Yes. Okay, good. That's just a requirement by your surgeon. Everyone is super specific here, so that's good. Looks like we've got our setup ready here. So why don't we just go ahead and get started? Right. I'm gonna start by placing a couple bands on you here. No allergies, right? I didn't see any allergies in your chart, so we don't actually need that one. But I am going to place a fall risk band on you. This is just because you're going to be on the local anesthetic. We want to make sure that we're giving you a little bit of extra help there because people tend to get kind of dizzy. And since we're actually going to be operating on this arm, I'm going to go ahead and put this on this side. Sure. So we have that on, and that will stay on you. And I'm going to go ahead and get started with my inspection. I just want to listen to your lungs and your heart. Okay, so I'm going to have you breathe normally at first, okay?
Sure.
Just regular breath. Good. Regular breath. Okay, and then I'm just going to undo a side of your gown if that's okay. Sure. I just want to have a little better listen here. So take a slow, deep breath for me. Good. Slow, deep breath. Go ahead and breathe out. Good. Okay, so heart and lungs both sound totally healthy. Okay, so since I have your gown open, I'm going to go ahead and place your tele leads on, and just got 5 little stickers here, and these are going to connect to the heart monitor. So when we get you to the OR, we're going to get you hooked up to a couple different monitors, and it'll just help us keep track of your heart, okay?
Okay.
So I'm just going to kind of reach in here. Perfect, okay. Okay, so we're all good there. I can get you buttoned back up for now. And do you want to do just a quick check of your pupils? All right, so I'm going to have you just look straight at me. And I saw that Sarah inventoried your glasses.
Yes.
So I'll let you keep those right up until we take you to the OR. I'm going to have you follow the light, so keep your head straight, directed at me. Follow the light with just your eyes. Good, very good. A little faster. A little slower. Good job. Any double vision here?
No.
Not seeing any floaters or anything.
No.
The light looks pretty normal throughout.
Yep.
Perfect, okay. So the next thing I'm going to do is have you look at the light. And now look over at my finger. Good. And look at the light. And my finger here. Perfect. And no double vision with that either?
No.
Okay. So I'm just going to have you look down for just a second. And then look up. Good. Okay, can I have you just open your mouth and say "ah" for me? Perfect. Throat looks clear. Never have any issues with swallowing or anything like that? Okay. Is it okay if I just have a couple feels of your throat there? Just want to get a couple palpations here. I didn't see anything in your history about trouble swallowing or any kind of edema in this area where I would think you would need to be intubated. If for some reason you do, that's something that we would obviously assess as it comes along, but for the most part, I think you're going to be pretty okay to do the awake anesthesia. We will have you continued on the oxygen. Open and close for me. One more time. And then can I just have you swallow? Perfect. Okay, so no issues with that as far as I'm concerned. I do want to do just one more thing. Since you're having surgery on your arm, I just want to do a very brief sensation testing, and that's basically so that we can assess it afterwards to make sure that there's no nerve damage during surgery. Okay. The risks are very, very minor, just something we want to make sure of, okay? So let's start with unaffected arm.
Yes.
Just close your eyes for me. Tell me if you're able to feel this.
Yes. 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 Yes.
Okay, and how about this?
Yes. Yes. Yes.
And does this feel different than this?
Yes.
What's different about it?
Swipe versus a poke.
Okay, and is this, would you say soft versus this sharp?
Yes.
Okay. Go ahead and relax your arm. I'm going to do the same thing on your affected arm. I'm going to just try to avoid that area because I know it's pretty painful. So
Thank you.
Close your eyes for me. Can you feel this?
Yes. 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 Yes.
And can you feel that this is sharp?
Yes.
Okay. So the last thing I'm going to do for sensation is I want you to tell me, actually a couple more things. I want you to tell me kind of bilateral sensation test here. This versus this, does that feel the same?
Yes, it does.
So same here.
Yes.
And we do same. And no sensation loss on either side as we go down?
No.
Perfect. And last thing, promise this time, I want you to just tell me if you feel cold here.
Yes. 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 Yes.
Okay, and no loss of sensation as we go down.
No.
Cold all the way down.
Cold all the way down.
Cold, cold.
Yes.
Good. Okay, very good, James. We will be retesting all of those later on after your surgery. The PACU nurse will retest that for you, okay? The post-op PACU nurse. Okay. So a couple things. Sarah did a COVID test and it was negative. Good news.
Good.
So don't have to worry about that. You won't have to have one redone. I do have a couple medications that I want you to take. I will give you these right after the surgeon comes in to talk to you. So she'll come in, she'll do just a brief once over what's going to go on during the surgery. I'll have you take these. They'll help you kind of relax a little bit.
Okay.
So 4 different things here. This one is an anticoagulant, just blood thinner basically, so you don't get any blood clots while you're in surgery. We have lorazepam, which is an anti-anxiety medication. It's just going to help you relax a little bit.
Okay.
I also have oxycodone, which is a pain med. You did say that your pain was already at a 5, and then after surgery, obviously, you're going to be in a little bit of pain, so we want to go ahead and go with that. And then the last one is just an antibiotic to prevent any infection during surgery.
Okay.
All those good with you?
That's fine.
Perfect. So we'll have you take those a little bit later.
Okay.
And what I'm going to do now actually is have a seat. I am going to come a little bit closer to you. I need to get an IV in you, okay? So we're going to do a peripheral IV. Shouldn't really cause you any pain, but let me know if it's uncomfortable. But this is pretty important for surgery. We need a way to access your veins in case of an emergency.
Okay.
Also is going to be the way that we give you that anesthetic, okay?
All right.
Perfect. So let me just scooch over a bit and we'll get started. Okay, so let's go ahead and get started with your IV. I'm just going to be touching your arm here. Is this a comfortable position for you?
Yeah, this is fine.
Okay. I'm just going to move this out of the way a little bit there. Have a look at your veins. Let me go ahead and take my light. So are you nervous for surgery at all? Are you feeling okay?
I'm okay.
It's a very minor surgery, and your surgeon today is so good. So early surgeries, I always say, are the best. You want to catch them while they're nice and rested. So veins look pretty good. Do you ever have any issue having your blood drawn at all?
No, I don't.
Around. Fill in there. Oh, maybe here. I think we got a good one here. Okay, so I think we're gonna go here.
Okay.
Warm that up a little bit. Okay, so I just have a ChloraPrep swab. And it's gonna feel a little wet, okay? It's just basically alcohol. Make sure we get that nice and clean. Perfect. Can you lift your arm up for me? I'm not gonna do it too tight. I don't want it to be uncomfortable. Let me know if this is too much. Is that okay?
It's okay.
if you can, is this an okay place for your arm here?
That's fine.
Okay. So I'm gonna do a 20 gauge, a little bit bigger than a standard IV. Reason for that is we need to be able to get emergency medicine in.
Okay.
So we want to have it big enough to where we have the space if we need it. Likely won't, but better to have it than not. Perfect. Okay. All right, James, so we're going in with a little poke here. It is going to be a little tiny bit uncomfortable, okay?
Okay.
So maybe you want to close your eyes.
Okay.
Ready?
Yes.
Going in. How was that? Not bad?
That was fine.
Okay. We're in there. I'm just going to get you connected here. Bear with me as I hold on to that. Still doing okay?
Yes.
Just gonna do a quick flush, make sure our blood return's looking good. Yeah, we're good. Just gonna pull back. And, all right, very good. No pain there?
No.
Perfect. Okay, so let me get you covered up. I do a little bit of a bigger dressing here. Stretch that arm out for me. There we go. Perfect. Okay. All right, very good. So I'm gonna go ahead and cap that off for you. Just a little infection prevention. And then just so this isn't hanging down so much and getting on your nerves, I'm just gonna tape that off. Okay, so this is Coban, and basically it's just gonna make it so I'm not putting the tape on your actual skin. So lift your arm for me. How's that? Too tight?
No, that's fine.
Perfect. Okay. All right. well, we are good to go. I am just going to take a couple measurements here. The last thing I need to do is block off the site.
Okay.
So the surgeon just wants me to kind of prep the area. I'm going to do a couple measurements. I have my surgical marker here. I'm going to block the site off for her. Okay. And after that, she should be coming in. Okay? So she'll come in, talk to you for just a second, and then it's pretty quick. I'm going to prep the OR. After she scrubs in, we'll get you in, and it shouldn't be that long. Okay?
All right, sounds good.
So we'll turn your arm over here, and I know it's a little painful. I'm going to try to be careful. So I do just want to see. I want us to give us a little bit of leeway there. So she tends to be kind of conservative with her incisions, so they're usually pretty small. Does that pain radiate out here, or is it mostly centered right where you have that?
It's kind of in the center.
Okay, so we're okay here.
Yes.
Okay. So I'm going to block off a little bit of a smaller area than what I normally would, only because I don't think we're really going to need to come out that far. So I think we're going to be looking at about here. And then obviously we're going to be working our way in there. Okay. And then I'm going to kind of go centered off there because it looks like most of it's kind of okay. All right. So she'll be coming in to look at that and be getting you in shortly. Okay, let me go ahead and clean this up. I will page her and let her know that you're ready. Okay. And I am going to go prep the OR.
Okay, thank you.
I'll see you soon. You have your call light. Call if you need anything.
Yes.
Okay.